Hi, and welcome to C Notes. This is John. If you give me a couple of minutes, I'm going to show you how easy it is to write detailed notes with C Notes. So we have our patient here, Bob, and his chief complaint is he has pain to biting on the lower left side. So we're going to go ahead and go into the exam mode. Preoperatively, we're going to take an x-ray, and the x-ray is going to be 18-19 area. Press periapical and close out. We'll go do a periodontal exam, check the pocketing, and the pocketing, there were no changes. We do a dental exam. We'll notice that there is amalgams on 18 and 19, both OBs, 18 and 19. And if we go into endo exam, we will find out about the symptoms, that they are sharp and spontaneous. They are lingering. The onset was about 4 days ago. And they're localized to chewing, biting, and cold. We'll go and see if there's any swelling. There's no swelling present. Let's go and look at the radiograph. The radiograph showed that number 19 had a widened PDL. We did some cold tests. We looked at the cold tests, and 18, 20, and 21 were tested normal. 19, tested normal, and 19 was moderate. Heat tests, all in the quadrant, tested normal. Percussion, all tested normal. And to tooth sleuth, 19 tested moderate. The other 3 tested normal. So with that, we knew that we have a diagnosis. We have a reversible pulpitis of tooth number 19. So we saved that. And we also, because of that, we know there's probably a fracture underneath there that's not showing up. So we're going to recommend as a treatment procedure an onlay. And we're going to do a patient consultation about inlays and onlays. So present was the patient, office assistant, proposed treatment, inlays and onlays. Patient conditions: fractured teeth, repeated dental procedures, failing fillings, cracks, pulpal inflammation, trauma, and we'll talk about aesthetics briefly. We have treatment purpose: restore function, improve the bite, restore tooth strength, remove the pain source, improve aesthetics if we can, and improve the overall restorative result. So the risk factors: well, poor oral hygiene, lack of professional cleanings, failed restorations. We could have clenching, trauma, parafunctional habits of severe wear could cause that crack. Systemic reasons: really none. Treatments discussed: we talked about inlays, onlays, and no treatment. Treatment discussion: we talked about treatment of secondary decay, if there is any. Operative outcomes: lifespan of the filling, temporization, length of the appointments, restorative outcomes, healing times. Operative risks discussed: well, there could be post-op pain, you could have discomfort and hypersensitivity, you can also have tooth failure. Non-treatment risks: tooth loss, pain, aesthetic compromise, restorative compromise. Procedural treatments may be required, and alternative treatments may be required in the future. And non-treatment extraction plus prosthetic are possibilities of alternative treatments. So we go to conclusion. Our next appointment is going to be probably for an onlay, number 19, treatment, 1 week, save. We'll close that out, and you can see how quickly we wrote a beautiful note. There is our note: pain to biting left side, perio exam, dental exam, endo exam, onlay, patient consultation. So you can see how beautiful this note is written, including a detailed events of the patient consultation, endo exam, which included the tooth numbers and the cold tests, heat tests, tooth sleuth, percussive tests, all included in there. And You can see how detailed this is. You can read it if you want. Freeze the video and read it on full screen. You can see how detailed it is.